Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. On this podcast, I have covered infertility treatment and also pregnancy through the trimesters. So it only makes sense this next episode is going to be about after the baby comes, or postnatal treatment. Did anyone else feel that while you were pregnant, the health and wellness of you was a high concern of the doctors, but as soon as you had the baby, the health and wellness of you or the mother kind of fell to the wayside? I've heard from way too many mothers that when they've even brought up their concerns about their postpartum body and what they're feeling to their OBGYN, which, remind you, is the doctor specifically for the woman, it's not the pediatrician, they pushed their concerns aside and said, "But you have a healthy baby." There is a tendency, and I felt it too, to put aside your needs and concerns once you have a baby. No one is questioning the desire to have a healthy baby, but mothers should feel that they aren't being pushed aside either. I'm not saying that all doctors are like this, and I had an amazing midwife who always made me feel like I was the center of her attention. She even made sure that I saw her 3 weeks postpartum because she felt that 6 weeks was too long to wait to check in with the mom. Most cases, if you have a C-section, then you'll see the OBGYN after 3 weeks. But if you had a normal vaginal delivery, it's not till 6 weeks. And I would have to say that I agree that when things are going wrong, they can go really wrong. And if you can catch it in the first couple weeks rather than waiting for 6 weeks, then you have a much better way of treating the mother. And also, you feel seen and you feel heard when you become the focus of those sessions and not just your healthy baby. It's sad to see that the standard of care for postpartum women is not what it should be. And I know there's a lot of people in this postpartum space that are talking about this and trying to bring this to light of how we need to treat the mothers during pregnancy, but then also after pregnancy. So in today's episode, I'm going to talk about ligamentous laxity, pelvic floor dysfunction, diastasis recti, and mid-back pain and posture. Let's start with ligamentous laxity. Now, when I was coming up with what I should talk about in this podcast, I crowdsourced a little bit on Instagram to find out what you all wanted to hear about the postpartum body and how to treat it. And it was amazing how many of you guys wrote about feeling loose, feeling kind of like a wet noodle, having no stability, and wondering where all that was coming from. Well, the answer is ligamentous laxity. I talked about relaxin, which is the hormone that's going through your body when you're pregnant, during my pregnancy through the trimesters episode. But it's still coursing through your body. So that hormone, relaxin, is in charge of causing ligamentous laxity. So those ligaments that are holding your pelvis together, they need to be able to expand to be able to take the weight of the baby and the growing abdomen. So you need that relaxin going through your body, especially when you give birth, because everything needs to pull apart to allow the baby to go through that birth canal. But it doesn't just stop coming through your body as soon as you give birth. So actually, it will be in your system up to 7 months after you've given birth or after you've stopped breastfeeding, whichever comes first. That means if a woman decides to breastfeed up to 6 months, then the baby will be past their 1-year birth date when that extra relaxin has left their body. So you can imagine why women are complaining about feeling soft and loose, even when there's so many months and even years postpartum, because of that relaxin going through the body and how it stays at a high level until so late that your body isn't able to kind of create that stability through the ligamentous structure again. So you're going to feel softer for a while. You might not be as tight as you would like, even though you're working out. There is going to be a difference. When does this increased ligamentous laxity become a problem? Well, if you view your body like a house where you need to have a strong foundational base, it's as if you now have scaffolding that's trying to hold up the house if there is a foundation that's a little wobbly. Now, if there is too big of a gust of wind or a small earthquake that comes through, there can be damage to the house because it doesn't have that stability and it's just being held up by this outside scaffolding that's not as strong as the foundation of the house. Your skeletal system is that strong foundation you need to be having, and the ligamentous tightness around there is what keeps it stable in that area. Now you're asking the supportive team of the muscles, the skin, and the fascia to be able to hold and stabilize your body. Yes, the muscles are there to help stabilize everything, but you need to have that underlying ligamentous tightness for this skeleton to be solid for you to be able to move it with your muscles. So if you don't have that anymore, problems can occur. And I think we all know what happens in those early days after you've had a baby. You don't want to wake the baby. I mean, that is like the number one rule. Never sleep a waking baby. So we contort ourselves. We move in the most ridiculous positions to make sure that we don't wake that baby. And I can tell you, I am victim of this as well. I have put myself in the weirdest positions because if I had my head just so touching her head, she would sleep. If I moved a centimeter, she would wake up. So I would spend long nights just in these weird positions to make sure that she would sleep. But the problem is I'd wake up with a kink in my neck or my back would be hurting because I didn't have that ligamentous structure holding me there. So to say that, too big of a gust of wind or a small earthquake coming by that could damage the house or your body isn't crazy to think about because we will do anything to make sure that our babies are sleeping because that means that we could be sleeping. All that contortion, all that weird positioning you put yourself into can be a problem because it will start to get these little areas off kilter and you'll start to get compensations in through your musculoskeletal system. Now what happens when that relaxin starts to leave your body? Well, let's continue the house analogy. And if you can't tell by now, I really love analogies. You had that scaffolding up because you were going to re-stucco the house. Now, there's been a little bit of an earthquake that's happened, so the foundation's a little off. But you think it's going to be okay. It should be fine because you're just going to cover up any of those cracks with the stucco. So you're going to go ahead and cover the outside of the house with stucco. Now, this kind of represents the relaxin starting to leave your body. So you're starting to get some of that ligamentous tightness back the way that it should be. Do you think that stucco is going to stay nice and pristine? Or do you think that it's going to get cracks? Is it going to start to chip away? Because if the foundation isn't strong, you're going to start to see where the limitations of the house are. So this is why I even had someone ask about, well, I'm 8 years postpartum and I'm still having issues. Well, it could be that as that relaxin was leaving your body was already in a bad alignment because of everything we do in motherhood, the contortions of our body, the changings of our posture, the way our bodies even just change with pregnancy. And then instead of fixing those problems first, it all kind of tightened down, that stucco tightened down, and you're really locked in that position now. Now, you can be locked in that position for a little while and your body's still used to kind of compensating and it's okay, but eventually you're going to start to get cracks in that stucco. That's going to show on the outside of the house what are the problems on the inside of the house. So this is where the big issue comes with this ligamentous laxity postpartum. It's not so much the ligamentous laxity while you're going through it. I mean, yes, you are more susceptible to hurting your back or hurting your neck and getting these kinks. Like, yes, 100%. But I see the biggest issue is actually after that ligamentous laxity goes away and your body's now stuck in this really bad position where those compensations in the musculoskeletal system are much more solidified than they were when you had the relaxin going through your body. Now, the areas that I see to be the biggest problems with this is the SI joint and then pelvic height differences. So someone will always say like, yeah, I always feel like my leg length is off, that I've always told that my right leg's longer than my left leg. But I wonder, is it a true leg length discrepancy or is it a functional leg length discrepancy? If the heights of the femurs are the same, then it is a functional leg length discrepancy, and that has to do with the pelvis. So the SI joint pain, pelvic height differences, and low back pain are the most common that I see and will remain for many years to come. This is why I always ask my patients too, my female patients, if they've had any children and what were the births? Were they vaginal or were they C-section? And how was their body affected afterwards from having kids? Because it's a big change that you're asking your body to go through, and the recovery process is just as important. So what's my solution to this ligamentous laxity? Well, I think that someone needs to go in for checkups right after they have the baby, because that's when the relaxant's going to be at its height. And you want to make sure that, especially from the trauma of having birth and going through it, that everything's in a good alignment. So that as the relaxant starts to leave the body, because it will lessen, it's at its height right at delivery. So it starts to lessen. You want to make sure that everything starts to get tighter. And then if the woman decides to breastfeed, I want to see her about 4 or 5 months after she stopped breastfeeding. Or if she decides not to breastfeed, then I want to see her 4 or 5 months postpartum. Because I just want to make sure before everything is out of the body, all that extra relaxant's out, that we have a good structure for the house, that we fix the foundational issues of that house, so that hopefully as that stucco starts to solidify, it's solidifying around a strong house. Another component of having a strong foundational base is dealing with any pelvic floor dysfunction. This is a subject that probably deserves its own episode, and I'll probably do one in the future. But for now, let's talk about a few key points. Pelvic floor dysfunction is common, but it doesn't mean that it needs to be your new normal. It's not efficient. You shouldn't have pelvic floor dysfunction. If there was one structure I wish all postnatal women could have treated, it's the coccyx or the tailbone. And it's kind of because you get the most bang for your buck out of this one. There are 27 fascial connections onto the coccyx. Now, the coccyx, or the tailbone, is only about 1 inch to 1.5 inches long, depending on someone's anatomy. So 27 fascial connections onto 1 inch long bone. Do you think if that's out of place that could cause a lot of issues? The answer is yes. It doesn't matter either if you had a vaginal birth or a C-section birth. You can have changes in your tailbone. Now, obviously, if you're pushing the baby out in a vaginal birth, there's a lot of trauma that can happen to the tailbone, and some women even fracture their tailbone during pregnancy and delivery. But even if you had a C-section, you can still have major dysfunctions of your tailbone, and this is because of all those fascial connections. So even though you might have had a C-section, you definitely need to have your coccyx treated. So if you had a baby, coccyx should be treated. If you had a vaginal birth, did you tear or did you get an episiotomy? Better believe that coccyx needs to be treated if that's the case. Many of your pelvic floor muscles are attaching directly onto the coccyx. So if you tore or if you had any sort of cutting of it, the episiotomy, then it can affect how the coccyx is positioned. In the world of functional manual therapy, the coccyx is a keystone structure of the body. That means that dysfunctions of the coccyx can and will cause changes all over the body, and I mean all over the body. And treating the coccyx can help these areas, but treating those other areas of dysfunction will not affect the coccyx. So that means that if a woman has a high pelvis on the left side, we'll say, so the left side of her pelvis is really elevated. If I was to treat just that pelvis, and bring that down on its height, the dysfunctions that I felt at the tailbone will not have resolved. But if I treat the coccyx and resolve those dysfunctions, it is not uncommon that then when I stand the person up, the pelvis will be back at an equal height or very close to it. So the coccyx has a huge component and is a keystone structure of the body that needs to be treated. And like I said, because it has 27 different fascial connections onto it, it's a big structure that should be treated, and it is greatly affected during pregnancy, but also during childbirth. Getting to the coccyx treated will help with core strength because of those pelvic floor muscles that are attaching to it. It will help with your diastasis, because actually a lot of the fascia that's going through all your organs into your abdominal cavity attached to the coccyx. Urinary incontinence because of tight pelvic floor muscles or loose pelvic floor muscles and that core strength. Other issues with tight pelvic floor muscles as well. So if the tailbone's off to one end or if it's too extended, it will cause tension in through the pelvic floor muscles. And then also painful intercourse can also be addressed by treating the coccyx. Now, this is also a common topic, No one asked about it. I was kind of surprised on Instagram about painful intercourse after having a baby. There's multiple components to painful intercourse. It could be a hormone issue with lubrication. It could be that you did tear and those tissues need to heal. But the issue might be tight pelvic floor muscles. And in that case, the coccyx should be treated to help kind of decrease the tension put in through there. And honestly, it only takes 15 minutes to treat. So why aren't all women getting this assessed right after they give birth? Because like I said, regardless of if it was C-section or vaginal, you're going to have potential for coccyx dysfunction. So why isn't everyone getting treated for this? Why isn't this part of the normal standard of care of postpartum? I don't know yet. Now let's talk about diastasis recti. Now, I talked about this a little bit on episode 8, Pregnancy Through the Trimesters, about what I think you can do before trying to get pregnant to decrease your chances of getting a diastasis recti. The numbers are varied on this. Some research says 100% of women will get it, others say 60%. So needless to say, there is a good chance you could get a diastasis recti, but it doesn't need to stay that way. If you look up at a cross-section view of a woman at full-term pregnancy, an anatomy picture, you'll wonder where the heck her organs are fitting. And I can tell you, they don't fit in there very well, and the small intestines, and especially the mesenteric root, get the brunt of it. Now, if you go back to my episode 8, you'll hear me talk about the mesenteric root. It's a little bit more in depth there, but I'll kind of cover it very quickly here. You need to mobilize the mesenteric root, that is the suspensory ligaments fascia that's holding up the small intestine within the abdominal cavity, to get the edges of the abs to come together again. The mesenteric root is kind of the holding together of the small intestines within the abdominal cavity into the back wall of the abdominal cavity. So if you were to lie on your back, the leaves of a tree are your small intestine, and then the mesentery are the branches, and the mesentery comes back to the mesenteric root, or the root of the tree. Those fibers, they don't just stop there in the back. They actually wrap around the outside and go to the front, and they attach to the outsides of the rectus abdominis, or your six-pack abs. And that diastasis is the splitting apart of the rectus abdominis. In that episode 8, I talk about how to treat the mesenteric root by kind of pulling it forward and then relaxing your abdomen. And I also have this on video on my Instagram as well if you need to see a visual of it. But it seems counterintuitive, right? To actually stretch and pull out your stomach to fix the pooch that you feel like you have on your stomach that when you're just at relaxed state. I understand. It seems very strange. Like, why would I want to pull my stomach out if I'm trying to get it so that everything goes back in again? Well, what you're trying to do is improve the recoil of those tissues that are wrapping around and going to the front. You're trying to improve the elasticity of them. So by stretching them and getting them moving, you're actually increasing the blood flow to the area. You're increasing just all the fluids that are in your abdomen going into that mesenteric root to re-lubricate it, and then it becomes more elastic. So when you're no longer pulling those small intestines and mesenteric root forward and you relax your hands, then you actually get this recoil of those tissues. And as the fibers that are going and wrapping around to the front, to the outside borders of the rectus abdominis, those relax and let everything go back in together. So I get it. It sounds counterintuitive, but just trust me on this. And if you can understand the visual of how you have to pull forward to get it to relax, it'll start to make sense. I'm going to bring back in my house analogy right now. So my view when treating a diastasis recti is I want to fix the structural integrity of that house before I strengthen it. So I want to make sure that everything on the inside, the load-bearing walls, the studs, everything is in a good place to be able to hold that house. And then I add the outside to it. So I like to fix the issues with the mesenteric root and with the coccyx and any other kind of fascial adhesions in through the system first before you start to strengthen it as well. Because yet again, like we're talking about that stucco outside the house, you can try to plaster the cracks in your walls, but guess what? Those cracks are just going to come back and be visible. Now it's just going to have more plaster on top of it. So you really want to try to improve the structural integrity of the system first. And I think a lot of that has to go with first the coccyx and then second of all, that mesenteric root. And this shouldn't take a long time. Now, personally, it's about an average of 3 sessions that a patient has with me to fix their diastasis. And my focus is to improve the structure, and then it's giving them exercises to do at home to then help strengthen their cores now that they have the integrity and that solid foundation back. So it doesn't take that long. And I think there should be more focus on trying to help women earlier on than later when they're multiple years postpartum and struggling with even more issues, because a diastasis recti is just showing that there's core dysfunction, and there's going to be more breakdown if the core is not functioning right. So let's talk about mid-back pain and posture. Remember when I spoke about that relaxin'? Posture becomes very important in these days because you don't have that ligamentous stability that you used to have before. And when you're breastfeeding, you'll often get mid-back tightness because of the added weight of your breasts and also the poor posture you have when you're feeding the baby. Make sure that if you are breastfeeding, that you have a really supportive breastfeeding bra that really holds up the weight of the breast tissue and all the milk. Also, use pillows to bring the baby up to the nipple, not the nipple to the baby. I don't know how many women I see just bent over trying to put their nipple into their baby's mouth, when really you need to hoist that baby up to the nipple so that you're not rounding through your back. This will also make sure that you don't get clogged ducts, because if you're rounding, you're going to be crimping your breast in different areas that can kind of kink the milk ducts so that you're not getting as good milk flow. So you want to be in as best posture possible. And the best way to do that is to use those breastfeeding pillows. I loved my breastfeeding pillow. There's a couple out there on the market. You don't have to have those specific ones, but it was just easy to have something I could quickly strap around me and plop her on, and I knew she was safe and comfortable, and I could have her at the right height to be able to put myself into proper posture. So please, if you're breastfeeding, try not to bend forward. It's not going to help the situation on many reasons. If you're in a place where you don't have your pillow, my best suggestion is to almost lean back in your chair wherever you're sitting, so that then it's easier for you to hold the weight of the baby. Because we all know that when the baby's first born, it's way lighter, but then pretty soon it's going to start gaining weight and it's hard to hold with your arms that way. But if you're almost in a reclined position, it's easier to hold the baby because the abdomen is also kind of holding and being a support structure other than just your arms. So try and use a breastfeeding pillow if you can. And if you can't, then go in a reclined position. I don't like the reclined position at all times, because if you don't have good head support, then you're going to be stressing your neck a little bit as well. But whatever you can, just try to get in the best posture possible so that you're not going to be pulling in through your mid-thoracic back. I remember those days when my daughter did not want to be put down, where all she wanted was to be in mommy's arms, and yet mommy had a million things to get done. This is where I love the use of slings and wraps and different carriers. These baby wearing devices are great for many reasons. First, they're usually designed to keep the baby close to the center of your gravity. So it's not going to be a strain on you if they're too low or too far forward. It's going to be right more in a comfortable position. It's going to hold them very close to you, which is where they want to be anyways. And you have the use of both your arms. Now, when using the slings, wraps, and carriers, please look at the weight requirements and then also the placement of the baby's hips. All of those carriers out there have really great videos online and descriptions in their pamphlets that they come with about what you need to be aware of with the baby's size and also how the baby should be properly positioned. But I love the use of slings, wraps, and carriers. I think it just helps you have a better position of your body while being able to be functional, because there are a million things to be done when you have a newborn. If you don't have use of the baby wearing techniques, or the baby just doesn't want to be in them, because of course that happens too, they're finicky little things, you want to keep the baby as close to your chest and the center of gravity as possible. I prefer that the baby be in front of you if you can, because the tendency is if you hold the baby on your side Every mom loves to jet her hip out because it's like the perfect little step for the baby to sit on. A perfect little seat is your hip all off out to the side, which is terrible for your back. So if you can, put the baby in front of you, try to hold the baby as close as you can to your chest. If you do have to have the baby on your hip, because that happens too, because they want to see the world, right? So they don't want to be necessarily facing you the entire time. You can have them on your hip, but just try to not jut your hip out off to the side, and then also switch from side to side so that you're not focusing on one area. This is hard because we all have usually one arm that we like to use and one arm we feel strong holding the baby. It is really hard to switch from side to side, but try to, so that it's not one side of your body that's always having to compensate in some weird position, but it's equal on both. And the hope is that you have good alignment of your body, that foundational structure of the house is in a good alignment so that it can take the weight and the force put through having to hold your baby so much. So it all kind of comes together here. If there was one common thread that I was hoping you got through from this episode, it's that I really wish that postpartum care was better for women. I really wish that it was part of the standard of care that they saw a physical therapist after they gave birth, regardless if it was vaginal or if it was C-section or if it was easy or if it was hard, because no matter what, there's going to be changes to the body that occurred. And yes, we love that we have healthy babies. We feel blessed that we have healthy babies. But we want to be able to enjoy those babies and not be in pain. And there is a way to do that. And there are key structures of the body. And guess what? It's not going to take a million visits to fix those issues if you catch them early enough. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.